Welcome back. Now, today marks the beginning of Eye Care Awareness Month, and officials want to emphasize that simple eye care measures like tests are critical to your health and well-being. 80% of blindness can be avoided through prevention or treatment. We are now joined by Blind SA CEO Jace Nair. Jace, thank you so much for your time. Now, Jace, obviously this being a very important subject, but before we begin on the Blind Awareness Month, talk to us about, maybe let's get your reaction on the recent court ruling that will now see for the first time blind and partially sighted children across South Africa finally having a chance to access Braille textbooks.
Thank you for that opportunity. Blind SA has been campaigning for some time for blind and partially sighted children to get access to accessible formatted CAPS textbooks in Braille, in DAISY and audio. The settlement agreement between the Department of Education and the blindness sector has been in need for some time now. We are very excited that our children would get these textbooks. However, we are still concerned that the process in producing these books is quite a lengthy process, because books have to be first captured in terms of data typing. It has to be proofread and then produced in Braille, and that is still a long process for the books to be produced in all 11 languages in the country. Braille Services of Blind SA has launched a campaign, #GiveWordsWing. It is an attempt to try to get support from the public and the private and public sector so that we can produce these books so that children can have access to accessible learner-teacher support material.
Now tell us, what does Blind SA do? What does your work entail? And how well aligned are you to the South African National Council for the Blind?
Blind SA is a national disabled people's organization. We've been providing services of awareness raising and empowering blind and partially sighted persons for 72 years now. Our main projects include, firstly, in terms of advocacy, inputting into policy and legislation, looking at access to government services for blind and partially sighted persons, particularly access to education, that's early childhood programs, basic education. We have a huge challenge in terms of majority of blind and partially sighted persons do not have formal education, and therefore adult education and training is quite an important feature in our work. And then access to skills and employment. Then we look at providing accessible material in Braille for individuals as well as to the private and public sector. We provide Braille training to educators and facilitators at schools for the blind and adult education centers throughout the country, and to blind and partially sighted persons themselves. And then we look at orientation and mobility, is teaching blind and partially sighted persons to live more independently and to use the white cane more confidently. And then, of course, we look at how do we get blind and partially sighted persons into skills, into learnerships, and into employment programs throughout the country.
Now let's talk about blind awareness and also prevention. Now, quite worrying, you're saying 80% of blindness can be avoided through prevention or treatment. What are people doing wrong?
I think it's important, firstly, for all of us to make sure that we check our eyes regularly. We avoid putting foreign objects into our eye. We don't look directly into the sun. The challenge is that because of our economy and because of our health services, cataract, glaucoma, diabetes, and loss of sight through other ailments and diseases results in blindness. And therefore, it's necessary for us to make sure that all of us look at programs that will protect and take care of our sight.
We know that there are obviously measures in place now to, for in terms of health awareness, where somebody that suspects that they've got high blood pressure, they can just walk in any chemist and get a test done, and in minutes they would know, how well they're doing, or they can even have their sugar tested and so forth. How accessible are these tests where you can walk into a health institution and have your eyesight tested and the health of your eye, or is it something that you are also looking into in terms of making it accessible for everybody?
I think the challenge is that those of us who have medical aid and private medical cover may find it easier to walk into those institutions to get assistance in terms of eye test and spectacles and things like that. However, the majority of our communities go to public facilities, and due to limited specialists at public hospitals, we find that there's a huge waiting queue for persons to have eye tests or for eye operations. So we support the national insurance that is being promulgated. We believe that more people would have access to public services that would allow for eye care services at a primary level. So the national health insurance, I think, should provide more access. However, during Eye Care Awareness Month, the medical fraternity, ophthalmologists, optometrists, together with other service providers from the NGO sector, go out and try to provide limited services where possible.
All right, fantastic, Mr. Jace Nair. Thank you so much for your time and for that insight.
Thank you very much, and more information you can get from our website, www.blindsa.org.za.
Fantastic. Thank you so much.